UNC Center for Transplant Care, Liver Transplant Patient Orientation. Part 1, Introduction. End-stage liver disease, or ESLD, is caused by cirrhosis or scarring of the liver, which has caused so much damage to the liver that it can no longer keep the body healthy. Some of the causes of ESLD include hepatitis C or hepatitis B, alcohol, non-alcoholic fatty liver disease, autoimmune disease, biliary diseases such as PSC and PBC, clotting disorders, metabolic diseases such as Wilson's disease and hemochromatosis, or liver cancer. How can transplant help you? Transplant is a surgical treatment for end-stage liver disease, which removes the diseased liver and replaces it with a healthy liver from an organ donor. A liver transplant can offer improvements in your health, increased energy and well-being, less fluid and dietary restrictions, improved lifestyle and quality of life, return to work. Transplant may not be an option for everyone. Some patients may choose medical management over transplant. Part 2, Symptom Management. Whatever the cause of your end-stage liver disease, most symptoms are universal. Often, symptoms can be improved by medications or diet. Encephalopathy. This is the irritability, forgetfulness, fatigue, sleep disturbance, and confusion caused by the buildup of toxins that the diseased liver is not removing. It can lead to coma if untreated. Treatment includes lactulose, a liquid medication that can be adjusted so that you are having 3 to 5 bowel movements a day, and Xifaxan or rifaximin, a pill taken twice a day. Portal hypertension is caused by increased pressure in the liver's blood supply. This may cause varices or swollen blood vessels in the GI tract. They can bleed and sometimes be life-threatening. Treatment includes medications called beta blockers and endoscopy, which is a procedure checking for or banding varices in your esophagus. Problems with bilirubin. Your skin and the whites of your eyes may turn yellowish, called jaundice. You may have dark urine, light-colored stools, and itching. Treatment includes medications to thin your bile or help with itching, and you may need a procedure to open the bile ducts in the liver. Fluid retention. Ascites is fluid in your abdomen. Lower leg edema is swelling in the legs and feet. Hydrothorax is fluid around the lungs. Weigh yourself daily. Call your coordinator if you gain 2 pounds or more daily for several days in a row. Treatment includes medications, diuretics or water pills, diet, a low salt 2 grams, which equals 2,000 milligrams or less per day, or procedures to remove excess fluid from the stomach or chest areas. Diet and exercise. To prevent fluid buildup in your body, you must limit your salt intake. Limit the amount of salt or sodium you eat to 2,000 milligrams or less each day. Read the nutrition label on any food package to see how much sodium it has. You will meet with a nutritionist during your evaluation to help you with your specific dietary needs. Get rid of your salt shaker. Don't add salt while cooking or at the table. Eat fresh or frozen produce. Avoid canned food. Do not eat processed foods such as bacon, sausage, lunch meats, ham, and frozen or packaged meals. Practice reading nutrition labels. Eat only low-sodium cheese. Use pepper, herbs, and spices in place of salt to season foods. Try salt-free seasonings like Mrs. Dash, and do not use no salt or salt substitute products. Exercise and stress reduction. Exercise will help you maintain strength so you can recover more quickly from surgery. Try to exercise 3 to 4 times a week. It is important to find ways to reduce stress. Yoga, meditation, prayer, and visualization are some examples of things that can help. Try massage or other relaxation therapies if approved by your doctor. Alternative treatments for end-stage liver disease. Some patients choose medical management of end-stage liver disease instead of liver transplant. They can take medications and have procedures to help manage encephalopathy, varices, high bilirubin, ascites, and swelling. These are measures to help control symptoms of the disease. There are good treatments available for some chronic liver diseases. However, scarring and fibrosis of the liver may not be reversible. Other treatments may include hepatocyte transplantation for rare diseases or a partial liver transplant. If you have questions about your specific liver disease, please speak with your liver doctor. Part 3. Contacting your transplant team. In order to provide you with the best care, inform your coordinator, if you have any, changes in phone numbers, address, or insurance, changes in your care team support, illness of any kind, such as infection, including flu or colds, admission to an emergency room or hospital, any new medicines you have been given by any other doctors, and dates when you will not be in town for transplantation. Call the On-Call Liver Transplant Coordinator at 984-974-1000 for any urgent problems, day or night. For non-urgent problems and questions, send your coordinator a MyChart message or leave a voicemail for them. What if there is a problem? Call your coordinator for the following. They may refer you to your local physician. Fevers, nausea, vomiting, diarrhea, or increased swelling. Go to the emergency room or call 911 if you are vomiting blood, passing large amounts of blood or clots in your stool, experiencing chest pain, shortness of breath, if encephalopathy does not improve with lactulose, or if your family is unable to wake you. Part 4. Transplant Evaluation. The evaluation is usually a 3-day outpatient process at UNC Medical Center in Chapel Hill. It will include medical testing, blood tests, and meeting with the transplant team members in clinic. In addition, you may require the following tests or records if they are already up to date: vaccination records, colonoscopy or endoscopy, mammogram, pap smear. Your transplant team includes hepatologists or liver doctors, surgeons, anesthesiologists, nurse coordinators, nurse practitioners, physician assistants, social workers, financial coordinators, infectious disease doctors, nutritionists, psychologists and psychiatrists, pharmacists, and others. You will meet many team members during your evaluation. Your transplant coordinators. Your transplant journey starts with a pre-transplant coordinator. Once you have received a transplant, you will be managed by an inpatient coordinator. When you are discharged home after transplant, you move to a post-transplant coordinator. Responsibilities. Patient responsibilities include attending all appointments or letting a member of your healthcare team know as soon as possible if unable to attend, letting your healthcare team know of any changes to your health or financial status or changes to your caregiving plan, and abstaining from alcohol and illicit substance use. The transplant program responsibilities include scheduling the required tests and consults, making a decision about whether transplant is a good option for you at this time, communicating the decision in writing, and communicating significant changes in staffing of our transplant program. Substance abuse policy. Regardless of your history, all patients must not use the following while waiting for transplant and lifelong after transplant: all alcohol, including non-alcoholic beer, all street drugs, including marijuana, prescription drugs that have not been prescribed for you, tobacco or nicotine products, including e-cigarettes and vaping, even if it does not contain nicotine, and CBD or cannabidiol products should be avoided. Learning about liver transplant surgery. During your evaluation, the transplant surgeon will talk about, or you may want to ask about, what is the surgical procedure to be performed? What are the risks of the surgery? How is the surgery expected to improve your health or quality of life? How long will you be hospitalized? What is the expected recovery period? And when may you resume normal daily activities? Barriers to transplant include serious medical issues such as advanced heart or lung disease, non-liver cancer, or others, non-compliance with medications, appointments, or medical advice, active alcohol or illegal drug use, morbid obesity, or inadequate social support and transportation. Possible outcomes of transplant evaluation. Once all tests are done, your case will be discussed in a transplant committee meeting. Sometimes more tests or assessments are needed. If so, we will contact you to schedule the new appointments. If approved for transplant, your coordinator will send your medical information to your insurance provider for authorization before listing. You will be notified of the team's decision, for example, if you are accepted as a candidate, are not a candidate, or if more evaluation is needed. Please remember that you are not on the waiting list until you receive notification from your coordinator that you are officially on the list. You have the right to be listed at multiple transplant centers if you choose to do so. Check with your insurance provider to see if they will cover this. If your health, financial, or caregiver status changes after you are placed on the waiting list, then you may need to be reevaluated, placed on hold, or removed from the transplant list. Part 5. Waiting for transplant. The United Network for Organ Sharing, also called UNOS, is the organization that maintains the list of all patients waiting for liver transplants at all centers in the United States. The MELD sodium score. MELD stands for Model for End-Stage Liver Disease. It is a number between 6, which is very low, and 40, which is very high. It is calculated using the results of these blood tests: sodium, creatinine, total bilirubin, and INR. Livers are offered based on a combination of your MELD score, blood type, and height and weight. You will be told when you are in the top 10 in your blood type of patients listed at UNC Medical Center. Your position on the list will often change according to your changing MELD score and the MELD scores of other patients. Some patients may get a higher score for certain medical conditions. One example is liver cancer or hepatocellular carcinoma, HCC. Sometimes patients can get too sick to be transplanted and may need to be placed on hold on the list during that time. On average, UNC patients are transplanted with MELD scores starting in the mid-20s. Lab draws. It is very important to get your labs drawn when your coordinator asks you to do so. If you don't, it may change your place on the waiting list and can delay diagnosing or treating medical problems. The minimum required lab draw schedule when listed: for a MELD score of 25 or higher, once a week. For MELD score 18 to 24, once a month. And a MELD score less than 18, once every 3 months. Waiting on the list. You will have a yearly reevaluation that includes most of the same medical testing and visits with members of the transplant team. Where do livers for transplant come from? Most livers for transplant come from a deceased donor, someone who has died. Most organ donors have undergone brain death. No one can predict when a donor liver will become available. Living donor liver transplant is not currently offered at UNC Medical Center. If you are interested in this option, your liver doctor can refer you to a center that performs these surgeries. Donor risks. There are risks with any liver transplant. Many tests are done before transplant to identify risks in the donor and organ to be transplanted. These risks may come from the donor's personal history, medical condition, age, or possible undetected infectious diseases or cancer. At the time of an organ offer, you will be told of any known risk factors. It is rare that a serious disease will be passed along with the donor organ, but it can happen despite donor screening. Some examples are bacterial, fungal, or parasitic infections, viral infections including HIV, hepatitis C, or hepatitis B, and the spread of cancer cells. There are organs that may carry some extra risk because of donor factors such as donated after cardiac death, donor age, a donor with a lot of fat in the liver, a donor with a history of hepatitis B or hepatitis C. Some donors are thought to increase the donor's risk for infection with HIV, hepatitis B, or hepatitis C. All donors are tested for these viruses. You'll be checked for these viruses before and after transplant. Why accept a liver with added risk criteria? It can help you to get a liver offer sooner. Once listed, your liver doctor will discuss which donor options are best for you to consider in your specific situation. At the time of an organ offer, you will be told if the donor has any risk criteria. You can talk with a liver doctor about the specific things that make this a non-standard offer. You have the right to refuse any organ offer. Getting the call. Getting a call does not guarantee that you will get the liver. Sometimes the offered organ is later found to be not good for transplant for many possible reasons. You may be told that the surgery is canceled after you are already at the hospital. You may be called in as a backup in case the first intended recipient can't have the surgery. If the surgeon accepts the organ offer, the on-call coordinator will call you. You will be asked if you have been sick in the last 2 to 3 days or if you are taking antibiotics. You will be told not to eat or drink anything from that point on. You can take your usual medicines with a sip of water. A family member or friend must drive you to the hospital. Make your driving plan in advance. You will be told by the on-call coordinator where to report at the hospital. You will have some blood drawn and some tests done to prepare you for surgery. If you are diabetic, notify the nurses and doctors when you arrive so they can monitor your blood sugars. Bring all your medicines to the hospital. You may wait several hours between arriving at the hospital and going to surgery. Bring items to pass the time. Leave any valuables, such as your wallet, jewelry, or purse, and expensive electronics at home, or give them to your friends or family. Come quickly but safely to UNC. Are you ready? Some questions to ask yourself. Suppose you received a call tomorrow to come in for a transplant. How would you feel? Can you think of a situation where you would turn down an offer? What do you and your caregivers need to do to be prepared for the call to come to the hospital? What concerns or fears do you have? How might these affect you if you get an organ offer? Talk with your team about any concerns before you get called in for an organ offer. Part 6. Liver transplant surgery. The surgical procedure. Once you are in the operating room and have been given medicine to anesthetize you, several things will happen. You will have special IV catheters placed in your arms and your neck. A small tube called a Foley catheter will be placed into your bladder to measure how much urine you are making during and after surgery. Another small tube called a nasogastric or NG tube will be put through your mouth or nose into your stomach. This tube helps to drain your stomach and it will help prevent nausea and vomiting after the surgery. It is removed several days after surgery when your bowels begin to work again. You will be put on a breathing machine that will do the work of breathing for you for the first day or so. A large incision is made under your rib cage. Your new liver will be placed where your own liver is now, under your rib cage on your right. Your new liver will not have a gallbladder attached. You will have several small drainage tubes put into your abdomen. These are inserted around the liver to remove any fluid that may build up after surgery. These drains will be removed several days after surgery. The surgery usually lasts 6 to 12 hours. During surgery, family members can wait in the SICU or Surgical Intensive Care Unit waiting area at the time of transplant. An operating room nurse will be in touch when able during the surgery to update them on your condition. After surgery, the transplanted liver usually begins to work right away, but sometimes it takes the new liver a little while to work well, and until then you may still be very ill. After surgery, you will go to the Surgical Intensive Care Unit, SICU, for 1 to 2 days, where the nurses and transplant team will care for you very closely. From the SICU, you will either go to the Surgical Step-Down Unit, called the ISCU, or to 5 West, the transplant floor. As soon as it is safe to do so, nurses and physical therapists will work with you to sit up and walk. This may start in the Surgery Intensive Care Unit. This will help you to get better faster. You will be asked to turn in bed, cough, and breathe deeply at least every 1 to 2 hours while awake. This activity will help prevent complications such as pneumonia, constipation, or blood clots in your legs. Your surgical wound will have a dressing over it at first, but this will be removed before you go home. You will be taught how to care for your wound. Staples or stitches will be removed several weeks after your surgery. Lifelong medications. You will have to take medicine for the rest of your life. Immunosuppressants or anti-rejection medicines must be taken every day to prevent rejection of your new liver. Some other medicines will be stopped within a few months after transplant. For the health of your new liver, you must know what medicines you are taking and why. Part 7. Risks and complications of liver transplant. What are the risks of liver transplant surgery? There are risks with any surgery. Most patients will have at least one minor or major complication, but overall they do well over time. All surgeries have risks that include heart attack, stroke, and death. Some rare risks specific to liver transplant may include primary graft non-function of the transplanted liver, meaning the liver doesn't work, which requires emergency relisting for retransplantation. Severe organ rejection or organ failure that may lead to the need for relisting and retransplant. Abnormal heart rhythms, heart failure, or possible multiple organ failure. And blood clots requiring medication or a procedure to remove them, or, in extreme cases, relisting for retransplantation. More common risks of transplant surgery include bleeding requiring a blood transfusion or a return to the operating room to stop it, infections, wound separation at the surgery site, numbness around the site of the incision, fluid collection around the transplanted organ. Potential medical risks of liver transplant. Rejection of the transplanted liver. It can be treated if detected early by lab tests and biopsy. This may require hospital readmission. Some liver diseases can come back after transplant, including hepatitis C, hepatitis B, PSC, and autoimmune hepatitis. Your liver doctor will discuss your specific possibilities and treatments with you. Medication risks. There are risks to taking any medication. Risks from the use of transplant medicines may include diabetes, high blood pressure, increased cholesterol, osteoporosis, and kidney injury or kidney failure. Your doctors will watch closely for signs of these risks to occur. You need regular blood tests to find early signs of most problems. Potential psychological risks. These may include post-traumatic stress disorder, known as PTSD, anxiety, and depression. You may also experience the following: anxiety about being dependent on others, feelings of guilt, worry about problems getting medical, disability, and life insurance in the future. You might need counseling or medications to help you through this time. Please reach out for help. The Scientific Registry of Transplant Recipients, SRTR, puts out information about each transplant program's current outcomes, survival rates, and waiting times. This information can be located at www.srtr.org. For questions about this information, you can contact your transplant nurse coordinator. Part 8. Going home after liver transplant. The usual hospital stay after liver transplant is about 5 to 7 days. After discharge, you and your caregivers will be responsible for your own care. Preparing for discharge. Team members will meet with you and your family to teach you how to take care of yourself and your new liver. It's important that your main caregiver is available daily between regular work hours of 8 a.m. to 5 p.m. to meet with these team members for this important teaching. For several weeks after you go home, you must take medications correctly several times every day, get blood tests drawn up to 3 times per week, measure and write down your blood pressure and weight, speak with your coordinator about how you are doing, adjust your medications as instructed by our team, return to the transplant clinic often, and eat well and stay active. You may have to make frequent trips back to the hospital for clinic visits, lab tests, scans, procedures, or biopsies, or readmission to hospital to treat new complications. Call your coordinator if you think it might be difficult to follow through with any of your treatment plans. The good outcomes. Despite possible complications or hospital readmissions and frequent clinic visits early after transplant, after a recovery time, most transplant patients will enjoy restored longevity, feeling healthy, returning to work, family, hobbies, travel, athletics, and more. Remember, always take your medications correctly, stay up to date with lab tests and medical appointments, and contact us with any questions or concerns. In conclusion, your new liver. The goal of a transplant is to have a new beginning of a long and healthy life. Please remember to ask any questions you may have. We are here to help you through this process, and there is no question too small to ask. You can watch this video from home using the following link.